we have short of time. We'll take the question at the end. Now, the next talk will be on the important aspect in context to Pakistani society. And this talk will be delivered by Professor Dr. Muhammad Wasay. And कोई उनको तारीफ का वैसे कोई गुंजाइश बनती नहीं, सब लोग जानते हैं. He is teacher, he is researcher, he is advocate, he is mentor. I request him to start his talk.
Assalamu alaikum, bismillahirrahmanirrahim. Please share my slides, Dr. Abdul Malik.
सर एक सेकंड में ये बंद करके कर.
जी जी. So first of all, I would like to thank the organizers for organizing this important event. It's all in related to World Epilepsy Day. So Epilepsy Day is 13th February, which is Monday, and NARF is organizing event on even 13th February. So we had a press conference the day before yesterday, and now we have this CME activity. So a lot of activities are organized by our organization to improve epilepsy care in Pakistan. And I'm glad that, we have a good number of participants who are here to learn what are the challenges and problems related to epilepsy care in Pakistan. So epilepsy, you already know from Dr. Mehendi Rata and Dr. Tipu and Dr. Fawzia that what are the challenges related to epilepsy care in Pakistan, related to medical therapies, and even we learned the data from India that what is the status of epilepsy treatment and treatment gap in India. Can you share the slides?
Yes, sir. ये आपको स्क्रीन शेयर हो रहा है?
नहीं, स्क्रीन नजर तो नहीं आ रहा है.
सर आपके लैपटॉप की स्क्रीन नजर आ रही है, लेकिन उसकी स्क्रीन नजर नहीं आ रही. जी सर, अब नजर आ रही है.
अब इसको आप उस पर, हाँ ठीक है. So now we go. This is the global burden of diseases. Just a slide from WHO to let you know that, we talk about a lot of diseases, including heart disease, cancer, digestive disease, but as compared to other diseases, neurological diseases are at this point number one in the world in terms of disability and loss of years in life. Next slide, please. And among these neurological diseases, epilepsy is one of the common problems. Stroke is the problem which has the highest burden among neurological diseases, but epilepsy is about 7.8% of all neurological diseases. Next slide, please. And what is the burden of epilepsy in Pakistan and around the world? Around the world, about 65 million patients with epilepsy. In Pakistan, estimated 2.4 million patients with epilepsy, with a prevalence of 9.9 per 1,000 population. It's more common in children as compared to adult population. So it's 14.6 per 1,000 children. And there are about 50,000 deaths all around the globe related to epilepsy. And it's more common in younger than 30 years population and more common in rural areas. So epilepsy is a common, well-known problem. Next slide, please. In Pakistan and around the globe. Now, it's a very treatable problem. There are more than 25 medications, and we're still getting more and more medications for epilepsy treatment. So they are available in Pakistan. We have first-line medication, we have new generation medications, and we have medications which are quite affordable, maybe like Phenobarb is probably about 50-70 rupees per month, to more very expensive medication that may be about 8 to 10,000 rupees per month. But all kinds of ranges of medications are available. Surgical treatment is also available for epilepsy at one center. Most of the government hospitals, they are giving Tegretol and other old medications, but they are not providing newer anti-epileptic medications, which are the current trend and global all guidelines. They suggest that all patients should be treated with newer anti-epileptic medications because of a better side effect profile. We still have a huge treatment gap in Pakistan. We'll discuss in the next few slides. Next slide, please. So diagnosis of epilepsy is very easy. It's clinical diagnosis. Diagnosis is based on history of patient and family or the observer of this fits. You can rule out other causes of stroke by doing blood test, MRI and EEG. History of alcohol and drug abuse is important. And there is a good number of patients with epilepsy actually who had pseudo seizures and they're present with epilepsy. And this is the group of patients you have to diagnose by video EEG monitoring. And that's an important group we'll be discussing in next slide. Next slide, please. So there are a lot of myths about epilepsy. I think everyone has discussed part of it. So a lot of stigma, and which is basically our theme for this epilepsy day. So a lot of stigma in Pakistan. A lot of people consider it's a jinn or a save or a junoon. A lot of people think it's not a disease. It's something more kind of a spiritual thing. Some people think it's a psychiatric illness, or it's kind of a malingering or something like that. A lot of people think that it's not a treatable condition. If someone gets epilepsy, it's not treatable. A lot of think that patients with epilepsy, they just cannot do anything. So they cannot get education or job, or they cannot have a family life. And a lot of people believe that it's epilepsy is something which is to hide. It's kind of shameful. So these are different myths related to epilepsy, and they are all wrong, and they are basically all fake news, and they should be considered as fake news. So they have no value or no justification for any of these myths. Next slide, please. 70% of epilepsy, we are unable to find any cause. Or cause means you are unable to find anything on the MRI of the brain or sometime EEG. 30% they have traumatic brain injury, infections, stroke, and tumors, and 5% have genetic effects. Next slide, please. Among the treatment pattern, this is the data from Pakistan that 70% patients with epilepsy, they are not on the treatment. And only people who are on treatment in urban, it's about 35% and 8% in rural areas. 50% who are taking treatment are not properly treated. And most of the time, 70% of epilepsy patients can be controlled just one anti-epileptic medication. So it's very easy to control disease, but unfortunately, most of the patients do not get to the doctor and do not get to the right doctor, and they are not on the right anti-epileptic medication. This is what we call treatment gap, which is huge in Pakistan, and that can only be covered by awareness and advocacy. Next slide, please. So at this point, this is a major problem. Lack of awareness is a major problem among public, and there are also misperceptions. There is lack of awareness among physicians too, especially general practitioners and family physicians. Sometimes they are unable to diagnose or unable to treat the epilepsy, which is a kind of easily treatable disease for most of the general medicine and family practitioners. Affordability of medication is a problem, and lack of neurologists in country is a problem. So, very few neurologists in country, but most of the epilepsy can be treated with pediatricians or general physicians or family physicians. Next slide, please. Epileptic patients, and this is just information for public, that epileptic patients can do almost everything in the world which a non-epileptic can do. So they can get the education, they can go to masters or PhD, they can get married, they can continue a job, they can even play cricket or football or whatever they want to play. They can raise a family, they can do a social work, they can do into politics. And we know a lot of people who have epilepsy, and they are doing all kinds of things in our society. Next slide, please. So epilepsy in women, I think, is a major issue, and the stigma is largely related to women and children. So women is a group which actually is 90% untreated epilepsy group. So this is a major issue, and the reason is all stigma and taboo. Epilepsy and pregnancy is an issue, but it's very easy to control the issue by counseling and giving right medication. Risk of defects in children is a very minor issue, like less than 1% patient who are on anti-epileptic medication, who are pregnant, they develop any kind of birth defects, because now we have medications which do not cause a lot of birth defects. Most patients with the women who have epilepsy, they can do breastfeed, and it's not a communicable disease. So it doesn't go from like a mother to child in 99% time. Next slide, please. Epilepsy in children is an issue. There are very few pediatric neurologists in Pakistan, about maybe 10 to 20 in country. 90% of pediatric epilepsy is seen by pediatricians or general practitioners. I think this is an important group because for children, you have to kind of calculate the dose of medication based on weight, and then you have to increase the medication based on their growth, and you have to know the dosages and side effects, and a lot of counseling for the parents. So these are major issues related to epilepsy in children. Next slide, please. Public awareness is important, and our society, Pakistan Society of Neurology, Dr. Fawzia, and our Neurology Awareness and Research Foundation, they are doing a lot of awareness programs. We have done TV programs, we have recorded videos, and we are running it on public places. We celebrate World Purple Day, World Epilepsy Day. We are kind of working to develop a patient support group for patient support with epilepsy. So there are a lot of activities going on for public awareness. Next slide, please. For physicians of awareness, Dr. Fawzia is already organizing a mini fellowship for many years, and she has trained hundreds of doctors related to epilepsy. We are doing CMEs. We have trained more than 1,200 or 1,500 doctors in 20 districts of Pakistan by Pakistan Society of Neurology. We have issued national guidelines for epilepsy management that was authored by Dr. Fawzia. So it's available on the net, and it's for the general practitioners and family physicians. So this is a very important resource. Next slide, please. Government role is important for awareness and media campaign. I think there are few important aspects for availability of anti-epileptic medications. Number one, all the anti-epileptic medications, we think that should be considered as life-saving drugs, and their supply should not be halted. So the government or drug regulatory authority should make sure that these medications are available all the time. And they should also be available at the district hospitals and civil hospitals and Talika hospitals. And even we think that government should support newer anti-epileptic medications, especially levetiracetam and brevitiracetam and other medications at the government hospitals for epileptic patients. We should make availability of neurologists and diagnostic facilities at DHQ and civil hospitals in terms of EG machines and other facilities. I think we should also train our lady health visitors and lady health workers for identification and diagnosis of epilepsy patients and their guidance. And government also should support research and training related to epilepsy in Pakistan. Next slide, please. Epileptic patients need a multidisciplinary care. So there is a very strong role of patients and attendants, and there's very important role of patients and attendants, education and counseling. Doctors have definitely a most important role. But in addition to that, nurses, psychologists, social workers, media, so they all have a role in creating an environment for epilepsy care in country. Next slide, please. So in conclusion, burden of epilepsy is high in Pakistan, and epilepsy care is suboptimal. Awareness among doctors and patients is low, and we need a multidisciplinary approach to improve care for epilepsy patients in Pakistan. Cost and availability of medications is the issue, but that can be easily be resolved by the support of the government for epileptic patients. Thank you very much.